Eyes and Cataract Surgery Overview. The eyes are among the most vital organs of the body. Without them, life can become significantly more challenging. Over time, eyes naturally deteriorate or become susceptible to diseases. One of the most common conditions is cataracts, primarily caused by aging and often prevalent among the elderly. Many patients undergo surgery to restore their sight. Today, our medical team will provide recommendations for preoperative, intraoperative, and postoperative care to ensure the best surgical outcomes and to minimize the risk of complications.
Modern cataract surgery typically involves the use of ultrasound technology to dissolve the cloudy lens. This procedure is performed under local anesthesia, either topical or injectable. The cloudy lens is removed and replaced with an intraocular lens. The incision is small and usually does not require stitches. For harder lenses, other surgical techniques may be employed.
Pre-operative instructions. Practice lying flat without a pillow covering with a blanket for 30 minutes. This simulates the surgical situation, where patients lie flat under a drape covering the head and body, with only the operated eye exposed. Continue taking regular medications such as those for diabetes, hypertension, asthma, or glaucoma, as well as artificial tears if prescribed. If you are taking antiplatelet or anticoagulant medications, e.g., aspirin or warfarin, consult your physician. These medications are typically discontinued 1 week before surgery. If discontinuation is not possible, inform your ophthalmologist for proper planning. Ensure you get adequate rest the night before surgery. Thoroughly clean your body, including bathing, washing your hair, shaving, and trimming your nails. Avoid wearing makeup, jewelry, or bringing valuables on the day of surgery. Should wear a front button shirt for easy dressing after surgery. On the day of surgery, have a normal meal and take your regular medications, except antiplatelet or anticoagulant drugs. If a blood sugar test is scheduled, fast as instructed, but bring your medications to take after the test. Arrange for a responsible companion to accompany you, as patients are not permitted to drive home after surgery. Arrive at the hospital on time to allow for preoperative preparations. Intra-operative instructions. Remove shoes, socks, clothing, and jewelry, and change into the provided surgical attire and mask. Then, the staff will ensure everything is in order and prepare the eyes for the surgery. The medical team will clean your face and eyes with antiseptic solutions. Drape the surgical area. Patients must remain still. And follow the doctor's instructions to look at the surgical light or as directed. Avoid blinking, nodding, or shaking your head. Inform the doctor before coughing or sneezing so the procedure can be temporarily paused. Avoid touching the surgical area to prevent infection. The surgery typically lasts 15 to 30 minutes. Sounds from instruments and staff communication are normal during the procedure. After surgery, patients will be monitored for 15 to 30 minutes before discharge. Post-operative instructions. Do not open the operated eye until instructed by the medical staff, usually the next morning. Bring sunglasses for protection when the eye is uncovered. Attend follow-up appointments as scheduled, typically 1 day, 1 week, and 1 month after surgery. Resume regular medications, including antiplatelet or anticoagulant drugs. Eye drop application. Wash hands thoroughly. Pull the lower eyelid downward, then instill 1 drop of medication into a pouch. Eye ointment application. Wash hands thoroughly. Use one hand to pull the lower eyelid downward to form a pouch and the other hand to apply the ointment along the inner rim of the lower eyelid, starting from the inner corner to the outer corner of the eye. Avoid touching the tip of the ointment tube to the eye or skin. Use prescribed eye drops and ointments as instructed. Allow at least 5 to 10 minutes between applying different drops. Eye drops and ointments expire 1 month after opening. Clean the eye and eyelids using clean cotton soaked in saline solution. Squeeze out the excess moisture until slightly damp. Then wipe gently from the inner corner to the outer corner of the eye. Avoid wiping back and forth. Perform this once daily. Avoid exposing the operated eye to water or dust for approximately 1 month. When bathing, do not pour water over your head. Hair washing should be done by someone else or at a salon. Refrain from rubbing the eye. Always cover the eye with a protective shield while sleeping to prevent accidental rubbing. The shield can be cleaned with soap and water and must be dried thoroughly before use. Protect your eyes by wearing sunglasses or an eye shield outdoors to guard against dust, wind, and sunlight. Refrain from household chores such as cooking, sweeping, or laundry, as these activities may expose the eye to water and dust or trigger coughing or sneezing. Sleep on your back or on the side with the operated eye facing upward for approximately 1 month to avoid putting pressure on the surgical site. Avoid heavy lifting, vigorous head movements, intense exercise, and straining during bowel movements for 1 month. Maintain a normal diet, including high-fiber foods to prevent constipation. Refrain from driving for 2 to 4 weeks. If you experience any unusual symptoms, such as eye pain, increased redness, worsening blurred vision, green or yellow discharge, swollen eyelids, nausea or vomiting, or if the operated eye is injured or exposed to a foreign object, seek medical attention immediately.
Cataract surgery is generally safe. However, potential risks include the inability to insert the artificial lens in a single procedure, requiring additional surgery, corneal swelling, macular edema, and infections. Vision recovery also depends on pre-existing eye conditions such as glaucoma or retinal diseases.
By adhering to the guidelines for preoperative, intraoperative, and postoperative care, patients can ensure optimal outcomes without complications. With best wishes from the Relief and Community Health Bureau, Thai Red Cross Society. Contact Operating Room Department 02413-0560.